Welcome to Inside Pediatrics with Dr. Chadia Jebeli, pediatrician with medical training from St. Joseph University in Beirut and Université Paris-Cité in France. In episode 5, we will explore how to protect children's hearing. First question: why can't we measure sound the way we measure temperature or weight?
The human ear can detect an enormous range of sound pressures. The softest sound we can hear is about 20 micropascals, while the threshold of pain is around 20 pascals, a difference of 1 million times. A simple linear scale would be impractical, so we use the decibel scale, a logarithmic system that compresses this huge range into values we can easily understand. From 0 decibel, the threshold of hearing, to about 120 decibel, the threshold of pain. To put this into perspective, everyday sounds children encounter can already reach risky levels. A normal conversation is around 60 decibel. A busy school cafeteria may reach 85 decibel. Gaming headsets or earbuds at maximum volume can exceed 110 decibel, and firecrackers may peak at 140. But loudness is only part of the story. Sound also has pitch measured in hertz, the number of vibrations per second. Low frequencies create deep bass sounds, while high frequencies produce sharp treble sounds. The human ear typically hears frequencies between 20 and 20,000 hertz. Children's auditory systems are still developing, and they often cannot recognize when everyday sounds are already damaging their hearing.
Question 2. How does loud noise physically damage the hearing system?
Sound vibrations travel through the ear to the cochlea, a spiral-shaped structure of the inner ear. It's transformed into electrical signals transmitted to the brain. Inside the cochlea lies the organ of Corti, which contains 15,000 hair cells essential for hearing. They are extremely fragile and cannot regenerate once damaged. Exposure to excessive noise can therefore lead to two types of auditory injury. The first is auditory fatigue, a temporary reduction in hearing sensitivity that occurs immediately after exposure to loud sounds. During this phase, hearing usually recovers completely after a period of quiet rest. However, repeated or intense noise exposure may lead to permanent hearing loss. In this situation, hair cells die irreversibly, producing lasting structural damage. Hearing loss may be classified as mild, moderate, or severe. In children, the consequences of noise exposure are particularly concerning because auditory pathways continue to mature throughout childhood and adolescence. Repeated acoustic trauma can affect not only peripheral hearing sensitivity, but also central auditory processing, the brain's ability to interpret and understand sounds. As a result, children may experience difficulty understanding speech in noisy environments, such as classrooms, reduced ability to distinguish sound frequencies, impaired speech clarity, and tinnitus, often described as ringing or buzzing in the ears. Younger children may not always recognize or report these symptoms.
Question 3. What are the most significant risk factors and danger thresholds?
Hearing damage depends from the combination of sound intensity, duration of exposure, and frequency. High-pitched sounds being particularly aggressive to the delicate structures of the inner ear. A critical threshold is 85 decibel, far below the 120 decibel threshold of pain. A child can be sustaining cochlear damage while experiencing no discomfort whatsoever. If a child cannot hear you speaking at arm's length without raising your voice, the noise level is likely above 85 decibel and potentially dangerous. As intensity increases, safe exposure time drops sharply. At 85 decibel, exposure can be tolerated for a work shift with precautions. At 100 decibel, the level of a typical school concert or sports event, safe exposure is only 15 minutes. At 105 decibel, that window shrinks to 5 minutes. Personal audio devices are a particular concern. Studies show that adolescents frequently listen at 80% of maximum volume, often for hours. According to the World Health Organization, over 1 billion young people worldwide are at risk of permanent hearing loss due to recreational noise exposure. This is a preventable epidemic and we have to intervene early.
Question 4. What practical steps can we take to prevent permanent hearing loss?
The key to prevention is limiting exposure and using hearing protection. For parents, the key messages are, on headphones and personal devices, the 60-60 rule. No more than 60% of maximum volume for no more than 60 minutes at a time. For younger children, volume-limiting headphones that cap output at 85 decibels are a practical evidence-supported option. On noisy environments such as concerts, sporting events, or festivals, children should wear fitted earplugs, maintain distance from speakers, and take quiet breaks 30 minutes every 2 hours of exposure. On warning signs, children may not report symptoms. Parents should watch for behavioral cues, asking for repetition more than usual, increasing screen volume, or seeming inattentive in noisy settings. Symptoms to take seriously: ringing, buzzing, or that muffled quality older children sometimes describe after a loud event. If it's still there after a full night's sleep, we refer to an ENT and we get a formal audiological evaluation. The damage from noise is cumulative, silent, and permanent, but it's also almost entirely preventable, and every routine visit is an opportunity to make that difference for a child and their family. Thank you for your attention. I look forward to our discussion.